Welcome to today's video on fetal health assessment, focusing on fetal heart rate monitoring during labor. As nurses, we play a critical role in ensuring the well-being of both the mother and the baby. Let's dive into the different types of fetal heart rate monitoring and our responsibilities. First, let's talk about external monitoring. We have two main types: ultrasound Doppler and electronic fetal monitor, or EFM. The ultrasound Doppler uses sound waves to detect the fetal heart rate. Imagine placing the Doppler transducer on the mother's abdomen, typically in the lower quadrant, where you can hear the fetal heartbeat most clearly. This non-invasive method provides a continuous reading, keeping us updated on the baby's status. Now, with the electronic fetal monitor, we use two external sensors, one for the fetal heart rate and one for uterine contractions. These sensors are attached with belts around the mother's abdomen. The fetal heart rate sensor detects the heartbeat, while the tachometer measures contractions. Both readings are displayed on a monitor for continuous observation. Next, we have internal monitoring methods: fetal scalp electrode, or FSE, and intrauterine pressure catheter, or IUPC. FSE involves attaching a small electrode to the fetal scalp to measure the heart rate directly. This method is more accurate but requires cervical dilation and rupture of membranes. Picture a nurse following sterile procedures to attach the electrode to the fetal scalp through the cervix, ensuring precise heart rate readings. The IUPC measures the strength of uterine contractions. It's inserted into the uterus through the cervix, often alongside the FSE. This helps us assess the intensity of contractions and the fetal response. Moving on to interpreting fetal heart rate patterns. A normal baseline heart rate is between 110 to 160 beats per minute. Bradycardia, or a rate below 110 bpm, might indicate fetal distress. Tachycardia, over 160 bpm, could signal maternal fever, infection, or fetal hypoxia. Variability is another critical factor. Moderate variability between 6-25 bpm indicates a well-oxygenated fetus. Reduced or absent variability can signal fetal distress or other issues. Decelerations in heart rate patterns also provide vital information. Early decelerations usually mirror contractions and are often benign. Variable decelerations caused by umbilical cord compression might need position changes for relief. Late decelerations, starting after the peak of a contraction, could indicate uteroplacental insufficiency and require immediate intervention. Accelerations, short-term increases in heart rate, are typically reassuring, showing a healthy response to fetal movement. Now, let's discuss our role as nurses in fetal heart rate monitoring. We continuously monitor and document the fetal heart rate and uterine contractions using the appropriate devices. Interpreting the data helps us identify signs of distress and respond accordingly. Effective communication with the healthcare team is crucial for timely updates and interventions. We also educate and support the mother throughout the process, ensuring she understands what's happening and feels reassured. In case of abnormalities, we implement necessary interventions, like repositioning the mother, administering oxygen, or preparing for potential procedures such as a cesarean section. For example, during labor, if we observe late decelerations, we notify the obstetrician and initiate interventions like changing the mother's position, increasing IV fluids, and providing supplemental oxygen. We then closely monitor the fetal heart rate to assess and adjust the care plan as needed. In conclusion, fetal heart rate monitoring is a vital tool in ensuring fetal health during labor. Our role as nurses is crucial in interpreting data, responding to abnormalities, and providing comprehensive care to both mother and baby. Thanks for watching. Stay tuned for more nursing insights and tips.